yourself, and it's Arun.
Arun.
On Arun.
Okay.
On his head.
Hello, Arun. I'm here. I'm a wilderness first aider. Do you mind if I help you? Yeah.
He's so thorough. He's gaining consent again.
I'm gonna mobilize your head.
Yes, in mind.
Great. So at the D-step again, we'll talk about the D-step and making the decision to maintain mobilization. We'll talk about that after lunch. We'll dive into that more after lunch in our spine injuries class. All right. So head to toe exam. Keep this in mind. We want to have lots of laughs with our patient, right? Not the creepy laughs, but good laughs. So we want to look, listen, ask, and feel. So we want to use as many senses as possible when we're being thorough with their patient. So may we have uncovered a chief complaint, something that hurts our patient the most during the initial assessment, right? Perhaps, right? They might be screaming, my leg, or they may tell you a little bit more calmly, my hip hurts, or my chest, or something like that. We get the skin level. We've already done that. Now we want to go back and be redundant and be thorough, go over the entire patient's body. We don't want to make any assumptions that they're healthy or unhealthy, right? We want to leave no stone unturned, okay? So we want to be thorough. And again, start from the head, we end at the feet, and the last component is we're going to roll our patient, which we'll practice more this afternoon. We'll teach you some basic best practices now, but we'll refine it after lunch. And we'll palpate the spine and check the back, right? And then roll the patient back over. So head to toe exam. So in terms of the head, so Arun, you can just make yourself feel comfortable, all right? I'm looking, I'm listening, I'm asking, I'm engaging with the patient. So, hey Arun, I'm just gonna palpate your body, and again, this is professional touch. So again, gaining consent in this rapport with your patient. Hopefully they're trusting you. You're using it to the best of your ability medical terminology, but in layman's terms, so they understand, they gain confidence in who you are and trust that you're helping them, okay? And that's why we use professional medical speak and professional touch, okay? And professional touch is firm and deliberate, right? Not soft and gentle, right? That's for another time. But deliberate touch, professional touch, and I'll point out some best practices. So with my patient, start at the head. If they had a ski helmet on, a bike helmet, something like that, I can do my best to move it. Can I slightly move the patient's head, working with my partner? For sure, right? We're not going to cause any harm, right? It's going to be slow, deliberate movements. We're not moving it a lot. I can sneak off that helmet. And now what I'll want to do first, again, is spread my fingers wide and just go through the scalp and the back of the head, right? I'm feeling for any deformities, abnormalities, right? If I came across anything here, Arun, I felt a bump on the back. Is that normal for you?
Yeah, I have I don't know, something from childhood.
Sure, yeah, something from childhood. It could be, a cyst or something like that, but that's normal to him. Great, okay, and that's a great question to ask. Is that normal for you? Then I come to the face. I want to visually examine the face. And Arun, do you have any pain, discomfort in your face or on your eyes or cheekbones, jaw?
No, I think I'm okay. I'm not feeling any pain over there.
All right. If you said yes, I can get hands-on and palpate, but I'm just going to visually look to see if I see any abnormalities, deformities, and also talk to my patient. Arun, can you close your eyes for me? And on 3, can you open them up? 1, 2, 3. There you go. And can you open up your mouth for me? I'm checking for any potential airway obstructions like teeth, retainers, tobacco, gum. You stick your tongue out, say ah. All right, great. This airway's open. So again, I'm being redundant in this. Did I already do this in the initial assessment? Yeah. You'll find that there's a lot of redundancy built into the patient assessment system. And can you move your jaw around? Open up your mouth. Great. So I'm not too alarmed again with his face anatomy. If I did, I can get hands-on. But again, I'm going to visualize it. I'm going to work with my patient. I'm going to check in the ears for any blood. And if I can't bend over my patient, I might ask my partner rescuer, can you look in that ear? Do we see any blood coming out or any clear fluid, cerebral spinal fluid? It's more translucent. If I saw that, I would be inside. I would be a little alarmed. I wouldn't convey that to my patient. But those are the signs I'm looking for, okay? Possibly any bruising. If he had sustained a head injury, I might see bruising behind the ears. That's pretty severe. But again, I'm looking for these visual cues. All right, I don't see anything that's checking out. I'm gonna continue to move down. So now, can you take a deep breath for me? Great. His trachea is in line. It's not off to the side. I don't see any signs of respiratory distress. Do you wear any medical necklaces or bracelets?
I do not.
Great. And now I can come down and check the clavicle. So the clavicle runs, you can feel it on yourself. You know, midline is the sternum bone. And then the clavicle runs from the top, right, at like the base of your neck, over to your shoulder, okay? And firm touch, you know, a few pounds of pressure. Does that feel like a few pounds of pressure?
Yeah.
Yeah, firm touch, working my way down the clavicle. And then I come to the shoulder, and I fit my one hand, I gotta slide it under the shoulder blade, and then I make a little shoulder sandwich, and I press down. Any pain, discomfort there?
Yeah, that's something happened there. Like I definitely feel some pain in the right shoulder and the right hip.
What do I do at this point?
Just notice it.
Notice it.
Note it.
Note it.
If you haven't exposed it already, maybe you should.
Ah, yeah, get to skin level, right? So medicine happens at skin level. So if he said, ow, that hurts, I'm gonna do my best to get to skin level, check it out. I don't see any deformities or bruising, swelling, but I'm gonna make a note of it, right? And I can go back further down, we're gonna learn about treatments and how to treat different things, but I'm not gonna get sucked in, I'm gonna